Good morning, everyone. Thank you for joining us today to discuss some basic information about the secure side of the WPS website known as the portal. My name is Karen Curtis, and I'm a provider outreach and education specialist here at WPS. Today, I am joined by my good friend, Aline Sigler. Aline's also going to be helping me out today by monitoring the chat for questions you may have and providing additional information during the presentation. I have just a couple of things to cover before we get started. First, if you haven't downloaded a copy of today's presentation and would like to, there is still time. A copy can be found on our live events page, which is located within the WPS Training Center. In our list of upcoming events, there is a column titled Materials. This is where you're going to find a link to the PowerPoint material. I'm also going to have Aline add a link in the chat in case you need to get there quickly. Now, our training center also contains a web page for our encore presentations. All of our webinars are recorded, and as long as there's no technical issues, we will put these recorded on our web page. Videos are available for up to 90 days and can be watched on our webpage without you having to go to YouTube. We know that some of you may not be able to access YouTube from your company computer, and we want you to be able to receive the education that you're interested in. Recordings of our webinars can also be found on our YouTube channel, and they will remain out there until the webinar is either redone or if information has changed. Later, there will be a question and answer session if time permits. If you have questions related to today's topic, please send those using the chat feature. If there's any questions that I don't get to, or if some maybe require additional research, then an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience. We want to know how we're doing, so later in this presentation, you will be given the opportunity to provide feedback on today's event. This is your chance to let us know what we're doing right. Let us know if you feel there are areas where we can improve. And it also allows you to give us input on what types of education you'd like to see in the future. Now, while this is a CMS survey, WPS does look at their results, and we do our best to make the improvements that you ask for. Now, here at WPS, we do the best to provide you with accurate, up-to-date education. Everything I'm presenting is accurate as of today. I also need to let you know that CMS does prohibit recordings of our webinars. We record the events so that they can be posted as encore presentations. The recording will be available next week in case you would like to review or share any of the material being presented today. So today we're going to talk about the WPS Secure Net Access Portal. This is also referred to as SNAP or the portal. This is going to be an introduction to the portal. So I'm going to tell you about the different access levels. We're going to talk about how to get registered. I'm also going to let you know what functions are available once you have access. Now, this is going to be at a high level, but I do plan to hold webinars in the upcoming months to discuss each of these topics in a little more detail. We're going to start off with a little bit of general information. As stated in the name, the WPS portal is a secure network. This means that there are measures put in place to protect confidentiality, integrity, and availability of data and resources. Providers use the portal to obtain Medicare patient eligibility, check claim status, provide medical documentation, along with a variety of other functions. It's available to all providers, regardless of jurisdiction or whether you submit institutional or professional claims. Beneficiary eligibility information is provided using the CMS HIPAA eligibility transaction system known as HETS. Information is provided in real time. so you know that you're always getting the most up-to-date information. If you are inquiring about claim status, information is pulled from the Claims Processing Center. For providers that bill claims on a UB04 or 837I, this means that the portal's pulling the data from the Fiscal Intermediary Shared System, or FIS, to provide claim status. If you bill on the CMS 1500 or 837P, the portal is going to be pulling data from the multi-carrier system, or MCS. Now, there is availability 24 hours a day, 7 days a week, with some limitations outside normal business hours. HETS does have a defined maintenance schedule, so eligibility checks could be affected. The claims processing systems, FIS and MCS, typically come down every night, so this is where you could kind of see where maybe those functions are limited. Weekly maintenance is performed from Saturday at 11 p.m. to Sunday at 5 a.m. Central Time. Now, before we get too far, I want to let you know about a few basic requirements. We haven't gotten into all the functions that could be performed on the portal, but I have mentioned that providers can use the portal, check patient eligibility and claim status. So we are dealing with information that contains protected health information, or PHI, and personally identifiable information, or PII. Now, due to the sensitive nature of this information, users must agree to abide by some general terms of use. On this slide, you will find a link which will take you to the web page dedicated to the general terms of use. It is a little lengthy, but basically you should be a responsible user who is going to use the information you find for the intended purposes. You're not going to pretend to be somebody you aren't, and you're not going to do anything malicious. Automated programs are prohibited. Macros shouldn't be used for logging in and out or accessing any of the portal features. I know that sometimes we see macros as time saving or just saving us from performing repetitive tasks, but for the portal, these shouldn't be used. We also require a transport layer security, or TLS, setting of a 1.2 or higher because of the sensitive data involved. TLS settings have three primary functions. It encrypts data that is being transferred to protect it from unauthorized access. There's authenticity. TLS ensures that all parties involved in the transaction are who they claim to be. And lastly, it verifies that data hasn't been tampered with by third parties and that all information reaches its intended destination. WPS does provide steps for updating these settings depending on your browser being used. I have put a link on this page, and it's going to take you to instructions for Microsoft Edge, Firefox, and Google Chrome. But there are 3 different access levels that a user can have. And I want to talk about these because your available options will be different. Your home page is also going to look different. So if you attend some of our education, or if you're looking at the portal user manual and you're wondering why you can't see the option we're talking about, it could be because your access level does not have these functions. So the first access level is eligibility. At this level, you're going to have 4 functions available. My Profile, which is going to be your personal information, such as name, work address, email. Here, you will also find options that will allow you to change your password or security questions and answers. The Customer Service function will allow you to send an inquiry to the WPS Customer Service Department. These would be technical and non-technical questions related to portal function. For example, a technical question would include adding or removing service locations and site navigation. Non-technical questions would be things like claim submission questions or explanations for claim payment or denials. Beneficiary MBI lookup is a tool that can be used if you don't have the patient's Medicare number. Now, getting a copy of the patient's Medicare number is something that should be done anytime services are provided. But if you get in a situation where that didn't happen, this tool is available. You will need to know the patient's social security number, first and last name, as well as their date of birth. Eligibility has all of the patient's information related to their Medicare benefits. So you can find entitlement dates, primary insurer information, supplemental insurance information, as well as eligibility dates for preventive services that have frequency limitations. Now, the next level is a standard user. Individuals at this level will have access to all functions I just mentioned, as well as non-administrative functions. Now, we're going to take a closer look at these functions later on in the webinar, but this would be things like checking claim status, prior authorization, appeals and remittance advices. The third level is the MPI administrator. Now, individuals at this level will have access to all of the functions of a standard user, but they will also manage other users' accounts. Some of their responsibilities include approving or denying access requests, reminding users when it's time to recertify, and helping with password resets. Now, I do want to take just one moment. We're going to go out to the portal user manual. And if we click here on the home page, this is going to show you the different user levels that you could have and what your home screens are going to look like. So as you can see, if you're an eligibility user, your home screen is going to look a lot different than someone who's a standard user. So that's just something I wanted to show you so that you could keep that in mind when you are attending our education or when you're using the portal manual. So let's move into getting registered for our portal and initial access. Now, there are a couple ways to register for portal access. On our home page, you will find the registration link under the user ID box. Here you can see that I have outlined that in red, and this is going to allow you to self-register. You will need to have your MPI, PTAN, and TIN ready as this information is required. These would be technical and non-technical questions related to portal functionality. There's also the possibility that you will receive a message about registering as an MPI administrator. This occurs if the MPI entered has fewer than 5 administrators. So if you don't get that message, there's no reason to be concerned. Nothing is wrong. It just means that you already have at least 5 individuals in the MPI administrator role. Now, if you are not the appropriate person to take on this role, you simply click no and you continue with the registration process. And when you self-register, a request will be sent to the MPI administrator for your facility or office who will need to approve or deny access. This means that you will not be able to log in until your request has been approved. Now, the other thing that you can do is you can have the NPI administrator for your facility or office create an account for you. This is going to eliminate that approval process and it'll all be done right away. So let's take a moment to discuss the MPI administrator because they have an important role. Any MPI that registers in the portal must have at least one MPI administrator. I've included a link to the MPI administrator responsibilities because it is something that you definitely want to be aware of before accepting the role. Not only do administrators manage portal access for other users, but they also ensure that those users abide by the terms of use. They approve or deny requests for any user that registers using their MPI. If the user's account is disabled, they are responsible for reactivating the account. They remind users when it's time to complete their annual recertification. Now, to accept the role of MPI administrator, there is certain financial information that must be provided. You must have access to information that would appear on a written remittance advice that had been issued within the last 30 days. There are 3 options. The patient lookup will require the Medicare number and date of service for a beneficiary who will appear on a recent remittance advice. Choosing Medicare check number will require you to enter a check EFT number. The last option, Medicare claim number, will ask you for a claim number that has appeared on a remittance advice within the last 30 days. Now, this is also a role that can be taken on at a later date. Individuals who have eligibility or standard access can take on the role if more administrators are needed, or if the current administrator were to take a different position and can no longer perform their duties. So when you initially register for portal access, you will be asked to accept terms for use for transactional area and the general area. Transactional area refers to specific actions that take place within the portal, such as data transmission or user interaction. General area is broader and refers to things such as data privacy policies or copyright information. After accepting the terms, you will be moved to the provider access page. Now here you're going to enter your MPI, PTAN, and TIN. If you are part of a provider group or clinic, then you must enter the group MPI and PTAN. You will not be able to register using the individual provider's information. The portal will verify the information entered, and this is when you might be asked if you'd like to register as an MPI administrator. Again, this is not a role that you should, if this is not a role that you should take on, you can select no and continue to the next screen. That next screen is going to be the About You page. Here is where you're going to provide WPS with your name, contact information, and work information. So this is going to include things like your email and your work address, ways to contact you, things like that. So as we move through, the next step is going to be that you create a user login ID and password. The title on this slide is a link to the user ID and password requirements. We will take a look at that in just a minute, but the user login IDs are permanent and they cannot be changed at a later time. So whatever you pick is what you're going to have. Login IDs can contain numbers, letters, $, underscore, or hyphen. Now, passwords have a few more rules, and that's why I provided a link. While they can contain letters, numbers, and some symbols, they cannot contain your first or last name, characters like invalid characters that aren't listed in the requirements. The only special characters that are accepted are the hashtag, $, %, and ampersand. Your login ID cannot be used as your password, and it cannot contain a dictionary word of 4 or more letters. Passwords can only be changed once in a 24-hour period, and it must be different from your previous 24 passwords by at least 4 characters. So again, we're going to go out and take a look at this real quick, just so I can show you. So here with the login IDs, it gives you the requirements. Here's with the passwords. There are some suggestions out here. Passwords have been an issue in the past, so that is why I wanted to show you what other options you have. The portal, there are some suggestions here kind of help you with new passwords. But the portal can also generate a password for you. So clicking on the generate password button, it's going to autofill the new password and confirm password fields. Now you will need to remember this password the next time you log in. So if you're somebody that has a hard time remembering just random numbers, letters, symbols, you may not want to explore this option. I know I always have to use the tricks listed above, you know, like using numbers as letters or symbols as letters. I always have to use something like that for my passwords because if it's something random, there's just no way. But I do want to let you know that that is an option that you can use. But during the registration process, you are also going to need to create an e-signature. This is a second level of security that will be used if you forget your login ID or password, and also during the recertification of your account. The first thing you'll need to do is enter your date of birth. Again, please note this date cannot be changed, so you're going to want to make sure it's entered correctly. You will then have to choose 3 security questions. If you select questions where the answer is a date, please remember the format you used. The portal is date format sensitive. So this means if you answer a question and you spell out the month, you're going to have to do that every time. If you created your e-signature and your answer you wrote May 3rd, 2024, spelling out May, then the next time you answer that question, you're not going to be able to enter 050324, you know, just for example. Now, once you've created an account, you must log in at least once every 30 days. Failure to do so will result in your account being disabled. So if you're not someone who uses the portal often, then maybe set up a reminder on your calendar for, say, every 2 weeks. That way you're making sure that you're logging in and you're keeping that account active. When you visit our website, you'll find that the portal login box on the home page, simply enter your user ID and password and click log in. A box will pop up that contains an AMA license for you to view and accept. If you've attended any of our webinars where we discuss CPT codes, you have seen a version of this AMA license displayed in our presentations. It's kind of the same thing, just a little bit different wording. After accepting the AMA license, you will need to request a verification code. This code can be sent to your email, phone, or you can use a Google Authenticator mobile app. I wasn't sure how many people would choose to use the Google Authenticator, but I did create a link to the instructions found within the portal user manual. When you're ready to log out, you're going to want to be sure to click that log out button in the upper right corner of the screen. Doing this login, log out process, it will just help, you know, save you from having issues. Now, if you are logged into the portal and you have been inactive for 30 minutes, the portal will automatically log you out. This is a CMS mandate, and it is required because of the sensitive information contained within the portal. I believe in our line of work, most companies probably have security measures similar to us. I know here at WPS, we have two steps. The first one locks our screen automatically if we've been inactive for like 15 minutes. And then you're required to enter your password to get your screen unlocked. But there is a second step where if we're inactive for a longer period of time, the system does kick us out and we have to log back in with our user ID and password. So I'm sure this is something that's probably pretty common with most companies. The nice thing about the portal is that you're going to get a warning. So it's going to look like what you see here on the right. And you will notice down here at the bottom, it actually sets a timer. So you get a 5-minute timer that's going to count down before your session ends. So I know they are working on some things to maybe catch your attention more, but this will pop up, so you're going to kind of get a warning. So now let's talk about losing access. This can occur for a variety of different reasons. Disabled accounts. This means that the portal does not recognize your account as active. Now, this can occur if you haven't logged on within 30 days, if you haven't completed your annual recertification before the deadline, not accepting the terms of use during recertification, not attesting to completing your company's annual security awareness training, or clicking the Disable My Account button that is located within your My Profile page. Now, blackout MPIs occur when the MPI administrator loses access. This can occur because they haven't logged into their account at least once every 30 days, or if they fail to complete their annual recertification. Now, we will get into a little bit more detail about blackout MPIs in just a minute. Replicated accounts can also cause a user to lose access. The portal only allows users to have one account for the same MPI. So if two accounts are created for the same MPI using the same contact information, the portal is going to consider that a duplicate account. Now, in this scenario, both accounts will lose access to the portal. So how do you get these issues resolved? If your account has been disabled, the easiest option is to have it reactivated. Now, if you are an eligibility or a standard user, then your MPI administrator will be able to reactivate your account. This is not something that can be done by WPS staff. So if you are the MPI administrator, you have the ability to reactivate your own account by following instructions found in the portal user manual. If your account has been disabled for over a year, it cannot be reactivated. You will be required to register for a new account. Now, users who have had their account disabled for less than a year, they can also create a new account, but it's really just easier to have your existing account reactivated. Now, for blackout MPIs, since it's the MPI administrator who has lost access, other users will remain active for 30 days. This allows time for the current MPI administrator to reactivate their account or for someone new to accept that role and register as a new MPI administrator. Now, if the blackout MPI remains without an administrator, then all users under that MPI are going to lose access. This is definitely not something that a company would want to deal with. So definitely either want to get that MPI administrator to reactivate their account or get someone new to step in that role. Now, in the case of replicated accounts, the user will need to contact customer service to remove one of the accounts and to fix the replication error. This is not something that can be corrected by an MPI administrator. Simply removing one of the accounts is not going to resolve the issue. So the replication error has to be corrected by customer service staff. So I'd like to show you now some of the features that are available through our portal. Because this course is going over the basics, I am not going to go into great detail. I just want you to know what's available. Now, as I had said, I do plan on covering these options in more detail in future webinars. We're going to kind of take them all and break them down and go over them in a little bit more detail. So if you are a standard user or an MPI administrator, your first column is going to be titled Practice. I have two pictures shown here. The one on the left is a standard user. The one on the right is what the column looks like for an MPI administrator. You will see that it has an added option titled Users. My profile is your personal information. Here's where you're going to find information such as work address, email, billing credentials. This is also where you're going to find buttons to recertify, change your password, or disable your account. Now, users is an option for MPI administrators. So here is where administrators approve new access and registration requests. They edit current users' information. They can change access levels. Now, this is also where they would reactivate disabled accounts and unlock user accounts. Customer service allows you to send inquiries. These would be technical and non-technical questions related to portal functionality. If you have a question that is if you have a question that is claim or patient specific, you will need to include detailed information such as the patient's name, their MBI, dates of service, things like that, so they know which one you're talking about. The credit balance report is only available for Part A providers. If you try using this function and you have logged in with a Part B MPI, you will get an error message. The 835 enrollment change, this allows providers to submit electronic remittance advice enrollment applications or change requests to the WPS EDI department. We discussed these two options for beneficiaries a little bit earlier when I was talking about access levels. The beneficiary MBI lookup is a tool that can be used if you don't have the patient's Medicare number. You will need to know the patient's social security number, first and last name, as well as their date of birth. If all of the information entered is correct, the patient's information will appear and you will be given the option to check eligibility or supplemental insurance information. Eligibility has all of the patient's information related to their Medicare benefits. Entitlement dates, you can check to see if the patient is enrolled in a Medicare Advantage program. There's also tabs for home health, hospice, MSP, just to name a few. Now, the portal user manual does have a whole list of information that can be viewed. We also have an encore presentation covering all of the eligibility screens in our YouTube channel. So if that's something that interests you and you want to know more about, you can check that one out. Next, we have transactions. Prior authorization allows hospital outpatient departments and ambulance suppliers to submit prior authorization requests and supporting documentation to our medical review department. I'm sorry, just give me one moment. My throat's getting a little dry. Okay, sorry about that. If the provider exhibits compliance with Medicare coverage, coding, and payment requirements, CMS has the authority to exempt them from the prior authorization process. So the second option listed here is where providers can locate their exemption letters. There is a variety of actions that can be completed by clicking on the claims button. Here you can check claim status. Part B providers can submit claims, clerical error reopenings, and notify Medicare of overpayments by performing an overpayment claim adjustment. Medical documentation allows providers to submit medical documentation for pre and post payment reviews that are initiated by the WPS Medical Review Department. Now, this does not include documentation for PWK or in response to a FIS reason code U5601. This option can also be used to search for documentation that was previously submitted. Appeals allows providers to submit redetermination requests, Part A reconsideration requests, check the status and outcome of a portal submitted redetermination, and track a redetermination request that was submitted by mail or by fax. The appeals reconsideration is where providers can find the status and outcome of appeals reconsiderations that were submitted through the portal. The ACO Reach, this is a search function that allows access to fields on the provider participation files associated with ACO Reach demonstrations. If you don't know what that is, ACO Reach stands for Accountable Care Organization Realizing Equity, Access, and Community Health. It is a program developed by CMS to improve care for Medicare beneficiaries, particularly those with complex needs or who face barriers to accessing care. So that may not be something that you would ever use, but it is there in case it's needed. Our next column is finance. Clicking on the plus button next to refunds will allow providers to submit refunds, while clicking on the actual button that says refunds allows you to search refunds that were previously submitted in the portal. Refunds would be submitted when there's an overpayment that was received. This can occur due to a billing error or an adjustment to a process claim. The receipt button is for searching refund receipts that were submitted by any method. That includes e-refund, wire payment, or paper checks. Overpayments is for searching claims and overpayment information. You can search by demand letter number, transaction number, or claim number. If you're looking for status on a claim payment, then you would click on the payment status button. Here is where you will enter your MPI and claim dates of service. Payment results that match your search will be displayed. AP holds are going to give real-time status and resolution guidance for any accounts payable hold on your service location. Now, the last column that we have is notices. Your first option is going to be remittance advices. Here, providers can view and print most remittance advices. Now, in order for them to be available in the portal, it must have been issued within the last 24 months. They cannot be larger than 150 pages, and they cannot be for an incentive or a bonus payment. The portal will display the entire remittance advice, so you can't search remittance advice and just get it for one claim. It's going to be the whole thing. ADR letters allow you to view additional documentation request letters that have been issued within the last 90 days. Although not required, providers are also able to respond to ADR letters through the portal. Demand letters can also be viewed for up to 90 days after they have been issued. Responses to these letters may also be submitted through the portal. Now, I did not receive any questions during the registration process, so I am going to ask Aline if there has been anything that has come through the chat that we need to answer.
Hi, Karen. Thanks for that great information. That was a lot of good content there. I do not see any questions yet in the chat. I just put a reminder in there. So if you do have a question related to today's topic, make sure you add it there so we can get it answered for you.
Okay, great. Thank you. I will go ahead and move on then. Now, after the close of today's webinar, you are going to receive a thank you for attending email. Here is where you are going to find your certificate of achievement and contact hours for continuing education units. This email also contains a link which gives you another opportunity to provide feedback. If you don't get this email, please check your spam or junk folder. You will also need to add messenger@webex.com to your safe sender list to avoid issues in the future. If you joined only by phone, you will not receive this email. In that case, please send an email to the education mailbox that includes your name and the phone number that you used to join. That way, after we verify that you did attend, then we can send a certificate out to you. Now, if you do think of any questions after this webinar, you do have 7 days to send those in. You can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the subject line so that staff will know that your question is related to this webinar and will send it directly to me. Remember, if you have a question that is claim specific, those would need to go to customer service. Provider outreach and education, we don't have access to the system, so we wouldn't be able to view your claim. Customer service can provide you a response related to how your claim processed, so that would be your best option. When you disconnect from the webinar, you will be redirected to a CMS survey. I'm also having Aline add a link into the chat. Now, your feedback really does mean a lot to us. We review what you have to say. We do our best to make the changes that you ask for. This is also an opportunity for you to let us know what topics you would like to see us provide education on in the future. So if you have something specific, please let us know. Also, if you have ideas that you think would improve how you receive your education, be sure to tell us that too. We'd love to hear your ideas and do what we can to meet those. The redirect is going to look like what you see here on the bottom of the screen. We don't have any control over how this appears, and we do want you to know that it isn't spam or anything malicious. That does bring us to the end of today's presentation. On behalf of myself, Aline, and the Provider Outreach and Education team, I'd like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.